We'd like to call the Senate Health and Welfare Committee to order at this time. Thank you for being here today, and our secretary will take a silent roll at this time for us, and we'll get going on our agenda here. We have two gubernatorial appointments. One's an appointment, one's a reappointment to consider, and then we have the one that we had yesterday for reappointment that we need to take a vote on today also. If you look at your agenda, those are the two items, the three of them that we have on there. Plus, we will be starting our administrative rule process and looking at two rules today. And with that, I'm going to go in. The first gubernatorial appointment is from Lewiston, and he is on remote. And then our other one, that's the reappointment, is in person here with us today. So I'll get in and get this one. Okay, committee, we're having a little bit of a delay with our system, so we're going to go to the next gubernatorial reappointment of Chad Henggeler. And Mr. Henggeler, if you'd like to come up at this time to the podium, you'll have to turn on that microphone. It's a little toggle down at the bottom of the... There you go.
I get it.
Okay, thank you. Please identify yourself for the record, and the time is yours.
Chad Henggeler. I live in Fruitland, Idaho. So this is good afternoon, Madam Chair, Senators. This is my second confirmation, so I would be starting my third year on the Health and Welfare Board. I occupy one of two seats that is reserved for the business community. With that, I can stand for questions, or I can make a few comments, whatever the committee would like. You want to make a few comments?
Yes, please do.
Okay. So the Health and Welfare Board is probably it's a little bit different board than some boards that I'm accustomed to serving on. It's more of an oversight board in that we don't have any fiduciary responsibility. We don't really have any management responsibility. We do concur on appointments, but we don't advocate. You don't see me running down the halls on behalf of the Health and Welfare Committee. So our role basically is oversight. And so with that, when it's more rule making as much as anything, when rules come down, it's our board that tries to determine what the intent of the legislature is and how those rules will affect the department. So they'll bring rules forward. We look at them. We say, are they workable, or are they onerous, or are they punitive? And so that's a lot of our role. The other role that we really have is that we handle appeals. As you know, the Department of Health and Welfare has different enforcement issues that happen from time to time. And it's our board that really the citizens can bring forward if they have if they feel that they were mistreated or the laws or the rules weren't fairly applied to them. They come before our board, and we're kind of that citizen committee almost that basically determines was this a fair enforcement? Were the rules carried out as the intent of the legislation? So that's probably the major roles that I think we have. If you look at my bio, I remember in the last confirmation. So, like I previously stated, there's 2 seats for the business community. The question was asked, well, your bio is a little bit light on healthcare, maybe. Well, that's why, is because I basically represent the business community and how it affects us. And so, anyway, with that, I have any other comments, but I'd be happy to stand for any questions that the committee may have.
Thank you. Questions of the committee. Senator Lee.
Thank you, Madam Chair. Thank you, Mr. Henggeler. It's good to see you. As full disclosure, Mr. Henggeler is from my hometown, Fruitland, too, so it's so good to see you here. One of the things that I think maybe you could readdress, because I think we had you Zoom last time, so it's good to see you here. What is your business? And I think it's especially interesting from my perspective that your business had worked with health and welfare and the Department of Ag and some of those. So I think you're especially suited for this position, but that might give a little more background.
Sure.
Thank you, Mr. Henggeler.
Thank you, Madam Chair, Senators. Thank you for the question. So we're in the agriculture business, basically. We're in the packing shipping business. It's a 4th generation business and located in Pocatello County. At our peak during the harvest, I think we have probably 120 employees. Anytime you have that many employees, you deal with quite a few issues. That some of them may be, health and welfare type issues. Sometimes it's wage garnishments. Sometimes it's working with the courts to get people so that they can work and get time off. Different workers' comps issues. So when you have that many employees, you tend to see a lot of different circumstances that come your way, and you have that experience of looking at it through their eyes, and how can we better help them to sometimes just function in our society, but even sometimes get back rolling again. We've used prison employees. We've had them taken, or they bring them over from the penitentiary in Boise all the way to Fruitland, so we've used that labor. And then when it comes to rules and regulations, I mean, I have quite a bit of experience in rules, regulations, audits. We do food safety. We do health inspections. We do organic certification. I mean, we do INS. I mean, so I've been through a lot of audits, and so I think it gives me a little better perspective. When you see enforcement actions, done by the department, I can see both sides. And inspections, audits, they're very important. I mean, we have to have them. Otherwise, we're not going to be able to carry out their duties. But at the same time, they have to be reasonable. They can't be onerous, can't be punitive. And so I think that perspective probably is maybe what I bring to the board.
Thank you. Any other questions, comments? None? I'm in the agriculture business too, so I understand what you're talking about there when it comes to audits. And yeah, we have to do gap audits and things like that. So I understand that. And working with the Department of Agriculture too is pretty important. But when you talk about regulation and being onerous when it comes to those kind of things, I think having you there is a great thing. Thank you.
Thank you, Madam Chair.
Okay, thank you so much. We won't vote on your appointment today. We'll do that tomorrow. But we thank you for being here with us today.
Thank you, Madam Chair. Thank you, Senator.
Committee, I'm still not seeing our appointee up, so I think we'll just start going down with our agenda. The next thing we have up is the gubernatorial appointment of Mr. Sigler that we had online yesterday. that came in virtually. And at this point, I would entertain a motion.
Madam Chair. Madam Chair, I would move to send the gubernatorial appointment of John Sigler to the Board of Environmental Quality to the floor with recommendation that he be confirmed by the Senate.
Second.
It's been moved to confirm. Is there a second, Senator Taylor? Okay. All those in favor, say aye.
Aye.
Any opposed? None. Thank you. Got that one done. Okay. Let's just keep going down our agenda. The next item we have is docket 16-0302-20301, and this has to do with skilled nursing facilities. Mr. Elkins, Nate Elkins. Hello.
Hello.
Welcome to the committee. Please identify yourself for the record, and the time is yours.
Madam Chair, members of the committee, thank you for the opportunity to come before you today. My name is Nate Elkins. I'm the Bureau Chief under the Bureau of Facility Standards, Licensing and Certification, part of the Department of Health and Welfare. I am presenting docket number 16-0302-2301, found on page 147 of the 2024 Pending Rule Review Book.
Committee, do you all have your devices that you can pull that up on at this point? Or a paper copy of it, if. Okay, all right, proceed.
Thank you, Senator. Today, I ask you to approve this pending rule as final. Under Executive Order 2020-01, Zero-Based Regulations, IDAPA Chapter 16.03.02 of the Skilled Nursing Facilities was rewritten. The intent is to prevent the accumulation of costly, ineffective, and outdated regulations and reduce regulatory burden to achieve a more efficient operation of government. These rule changes represent a comprehensive review and revision of this chapter in collaboration with the public to streamline and simplify the rule language, while retaining or revising requirements necessary to protect public health and maintain the skilled nursing facilities. This rulemaking is not anticipated to have any fiscal impact on the state, general fund, or any other known funds. A negotiated rulemaking and public hearing were held, and we've received a few comments regarding adopting the guidelines for design and construction for nursing facilities and the elimination of staff requirements in the state rule. Some key changes are as follows: eliminating staff regulations that exist in federal regulation and prevent costly, ineffective, and outdated regulations, and reduce regulatory burden to achieve a more efficient operation. Incorporated by reference, Centers for Medicare and Medicaid Services, or CMS, requirements for long-term care facilities, and also the guidelines for design and construction of nursing facilities. Incorporated FBI guideline criminal history language to specify classifications of those required to have background checks and fingerprint checks, and enhanced tuberculosis-controlled measures. The rewrite of the 16.03.02 eliminates conflict between state and federal regulations, and it is necessary to protect the health and safety and welfare of those residents. The intended outcome is a rule chapter that is more easily understood and a useful tool for stakeholders, thereby facilitating business practices and rule compliance. The rewrite provides for the development, establishment, and enforcement of standards for the care of residents, the maintenance and operation of nursing facilities, and promotes safe and adequate care for each resident. We ask you to approve this pending rule as final. Madam Chair, Members of the committee, that concludes my presentation, and I stand for any questions.
Committee, do we have any questions? Senator Lee.
Thank you, Madam Chair. Thank you. I had a chance to review this, but if you were to just, and you gave us a nice overview, but what are the top three things that you think are significant in these changes? I looked at the difference between the criminal background check and the background check so that we're consistent with what you can actually check, and it looks like we've expanded some of those to be able to check additional records. What else should we know about this? What are the highlights that really, I mean, you talked about the building, you got some response to that. Was there any other feedback on the rules, and what are the top things that you think that this does for us? Just maybe in a bullet point.
Mr. Elkins.
Thank you, Madam Chair. Senator Lee, thank you for that question. There's significant changes throughout the entire chapter rewrite. One is the zero-based regulations that was presented by the governor a few years ago. Some significant changes is, like I said in the presentation, is it's reducing that burden regulation between the state and the federal regulations, or the state rules and the federal regulations.
For example.
Prior to that, we may have the same exact rule that was in the state as it was in the federal regs, and we were citing the facilities on twice for that. So that's what we did. We went line item by line item to make sure that the Code of Federal Regulations under the CMS guidelines, or Centers for Medicare and Medicaid Services, didn't match what we had in state rules. So we weren't basically double dipping on the citations when we're giving them to facilities. Obviously, it reduces the burden on the facilities, and it reduces the burden on the surveyors themselves. Another bullet point is the guidelines for design and construction. We incorporated that because we never had anything under the building code for health facility surveys or health facilities. We had NFPA, or National Fire Protection Agency guidelines, but it doesn't specify like room sizes, locations of restrooms, bariatric patients, ADA requirements, stuff like that. So that was a big factor as well, introducing those. And that is only for brand new buildings being built. It's nothing for existing buildings or anything of that nature.
Follow up.
So I see a lot more changes here, and I'm trying to walk through them. But on page 170, if we look at particularly under the administrator, I see a new rule that under A, each facility must employ an administrator on a full-time basis for day-to-day operations. Tell me the impact of that, and is that really new, or is that just capturing what was already required? Because that feels new.
Mr. Elkins.
Madam Chair, Senator Lee, that is somewhat new. It is in the federal regulations, Code of Federal Regulations, but it really doesn't specify specifically. The problem we were running into was administrators of facilities were living in New York or California, and the daily operations was not being consistently fed for those facilities. So that's why we wanted to present it in rules, to have administration under day-to-day operations, daily operations, to limit those outcomes, those significant outcomes that we were finding in the facilities for the health and safety of the residents.
Another follow-up question?
No, Madam Chair, I want to point out that these are policy, not policy, but they're rules that are changing. And so if you're telling me that the industry within Idaho says we really want a full-time person, and based on our workforce, a part-time person is not sufficient, I want to make sure that our industry also supported these rule changes. I see your point, but they're bigger than I think what the overview was. And
Thank you. I've got a couple of more questions for you. Senator Taylor.
Thank you, Madam Chair. Thank you, Nate. You've addressed my question about the NFPA, so I guess this is more of a statement. On page 151, it looks like some new language under the background check was added, and it says any state or federal child protection registry and any state or federal adult protection registry. And then line I is records and findings from other states and jurisdictions. I didn't see that in the old one, and I really appreciate that being put in the new one. I think that's very key, so thank you.
Madam Chair, Senator Taylor, thank you.
Thank you. Senator Wintrow.
Thank you, Madam Chair, and thank you so much for your presentation. I really appreciate it. Lots of people in the audience are maybe listening in, and when you did rulemaking, I'm guessing you gathered input from folks and, got information. So were there any concerns that came to your way as far as making changes to the rules?
Mr. Elkins. Sorry, we're trying to get the computer going better.
No worries. Madam Chair, Senator Wintrow, thank you for the question. We did. We had a few groups on our rule negotiation meetings.
Yeah.
And the biggest thing I think that came out of that was the nursing staffing regulations. In our old rule, we had specific numbers inside the rules. This one, we kind of took it out because in federal regs, they are trying to pass through CMS a actual number for nursing staff requirements. But what happens is what we find, even if we have 42 nurses per one resident, it's the outcome of that resident. So there could be bad outcome. So that's why we kind of implemented like compliance with staffing standards. It's not necessarily determinative of compliance because, the outcome of the resident. It could have bad outcome. So that's why we kind of eliminated it on that. We do have a rule or reg inside the federal regs that cover that in general.
Follow up?
Thank you, Madam Chair, and thank you for that answer. So basically what you're saying is in all the changes that you made, really that was the main thing that y'all talked about and came to some negotiation, but we don't have any real opposition to your rules, do we?
Mr. Elkins.
Madam Chair, Senator Wintrow, no.
Thank you. I appreciate that.
Okay, committee. Do we have any more questions? Seeing none, we'd like to thank you. Committee, do you feel like you're ready to vote on this docket, or would you like a little more time? Senator Wintrow.
Thank you, Madam Chair. Just for a question, I can't remember, but I think after presentation of rules for us to adopt, we allow for any testimony. Is that accurate? And maybe there might be some folks that want to say they support or not. Would that be helpful?
Thank you, Senator Wintrow, for reminding me. Thank you. Thank you, Mr. Elkins, for being here today.
Thank you. Thank you again, and I hope you approve this rule.
Okay, thank you. We do have someone that's here to testify. Robert Vandermeer. Welcome to committee.
Thank you very much, Madam Chair. Members of the committee, Robert Vandermeer, Executive Director of, or Vandermeer, any attempt is fine. You're good. Executive Director of Idaho Healthcare Association. We're the nursing home association. We represent assisted livings and home health and hospice as well. And I just want to commend working with the department. There were some really old rules in there that actually conflicted with federal regulation. And as most of you would probably know, it's the federal regulation that can close a facility. I don't know that any time in the history of Idaho a facility's been closed because of state regulation. It's a very high bar the Fed set for nursing facilities. Hospitals, you can actually pay for a JACO survey, and then the state doesn't do the federal enforcement. They're like, hey, JACO's got this. I may be oversimplifying, but I think they do comparative surveys to make sure things are in order. It would take an act of Congress to change that for skilled nursing facilities. So they come in, they're doing their job. They do a federal survey as well as a state survey. The state survey, everyone agrees, is like, okay, if it conflicts with the feds, are we trying to match both sometimes? One is, okay, this is a problem. The other one is, you're done tomorrow if you don't fix this. So the state regulations, I think there was some concern about the number of staff that have to be there per patient. But the federal regulations doesn't have a number. It's like, do you have enough? Which is really hard to meet. When I first took this job 23 years ago, a new administrator called me. He said, we just got a citation for insufficient staffing. I couldn't fit more staff in this building. He was right. I went out and visited. Every third step, you ran into a staff member. but they had the wrong kind of staff. They had one-on-ones that were like nurses' aides, brand new, didn't know how to stop a resident that was agitated. And so they had the wrong kind of staff. They had, like, how can we not have sufficient staff? And it was packed with staff. But they had a number of residents that with agitation, confusion. So they laid off most of their one-on-ones and hired more activity directors, hired more social workers, the right kind of staff that can actually intervene instead of just push the call light and hope someone comes. So that's the federal rule, is do you have enough staff? And every facility is not the same. Every facility is dramatically different. Some need a lot more staff because they have certain kind of patients. And on the federal survey, do you have enough? So you have to do a self-assessment. You have to have a plan. Why do we staff this way? So that the number, I think there was some heartburn about that number going away. But as Mr. Elkins mentioned, there is a proposed rule for the Fed to have a number, and it's double what the state rule is. So where does that staff come from? We'd love to hire more staff. Every facility would love to hire more staff. Medicaid's not going to pay for double staffing. And where do we find them? So the number to me is kind of irrelevant. There were some, like if you had 59 patients or fewer, then you could have one shift of RN, the other two shifts, the LPN could be the nurse on duty. And I asked a regulator one time, where does the number 59 come from? Well, we had to pick a number. It wasn't really evidence-based that is the number for every facility. So that I'm glad that rule's going away. You should do a self-assessment as a facility. Do you have patients that really need RN 24/7? If you do, you better staff an RN 24/7, not an LPN at night. So I think the state rule changes make sense. There were times where a state rule conflicted with Medicare reimbursement, which the feds don't care what your rules are. They're going to pay for what they pay for. So we support this. We appreciate them working with us. I wish you could change some of the federal regs, but you can't. So I will stand for any questions that you might have.
Thank you. Senator Wintrow.
Thank you, Madam Chair, and thank you, Mr. Vandermeer. I learned how to pronounce that a long time ago. I just wanted to say thank you for testifying, and I really appreciate all your hard work because you're one of those people that you can explain things so I understand, and you're very knowledgeable, and you're so experienced, and I just really appreciate your vigilance and really that balance of understanding what is safe and what's overregulated that could impede safety as well as the ability to have a business open. So I just want to thank you publicly for all your hard work and just really, again, you have such a good approach. You can explain it in the way that everybody can understand it. So I appreciate that.
Thank you, Senator Wintrow. We need you to give your credentials again for our secretary, please.
Executive Director, Idaho Healthcare Association. Licensed nursing home administrator, licensed assisted living administrator. I'm not sure that those credentials is what you were talking about.
Thank you so much. We have another question down here. Senator Bierke.
Thank you, Madam Chair. Mr. Vandermeer?
Good enough. That's great.
Curious, I like the idea of streamlining things, right? I mean, you've got regulatory agencies, whether it's the feds or the state, and it sounds like we're moving everything to comply with what the feds want, based on CMS reimbursement, and that's where the money comes from. Are we also addressing the issue of not duplicating the types of surveys and inspections, or are we still having just as many state inspections based on regulations that we're following from CMS? Or are we moving more towards a CMS kind of regulatory inspection and survey?
Mr. VanOrden.
Madam Chair and Senator, I wish we could work toward more state regulation, but that's not in the cards. Every administration in the federal government, in my opinion, and I've been at this for 30 years, has increased the regulatory burden every year for nursing facilities and most healthcare providers. We actually wondered what would it be like to just ask you to do away with the license. The feds require a license, a state license, so then there's got to be state standards to get that license. But it's really the Medicare, Medicaid certification that you need to be able to bill. There's very few people that can pay for a nursing home privately very long, 24-hour staff, 24-hour nurses, it gets very expensive. So almost all of our patients, if they need long-term care, will turn to Medicaid and Medicare. So we certainly contemplated, what if we just did away with the license and there wasn't another survey? What would the feds do if the state violated their direction of you must have a state license? I don't know. It wasn't something I wanted to be the guinea pig on.
Thank you. Seeing no more questions, thank you for being with us today. Do we have anybody else that would like to testify on this docket at this time? Come forward. Please identify yourself, and the time is yours, Lupe.
My name is Lupe Whistle, State Director, AARP Idaho. And we did send a letter with concerns with the staffing issue. And because right now, as it's been, as you heard, the requirement is for 2.46 hours per day of care to the resident. And that goes away. And we don't know what CMS is going to come up with. We don't know. So perhaps waiting until we hear what CMS is going to do, because 2.46 hours a day is not very much for those that need the care the most. And just wanted to voice that concern, and we did submit a letter, with that concern. So that's all I wanted to share with you this afternoon.
Committee, any questions? Seeing none. Thank you. Thank you for being here.
Thank you.
We do have Senator Wintrow. She wasn't quite as quick on the draw as she usually is.
I know. Sorry. Thank you,
Go
Madam
ahead.
Chair. Thank you so much for sharing that concern. So it sounds like you sent that concern in. Maybe I shouldn't have praised Mr. Vandermeer that much, but tell me, after hearing what he talked about and this whole process, are you feeling a little bit better? Are you concerned? Like what level of concern do you have? Is it at a 10
concern-
or is it a, you know what I mean? 10 being high.
Right. Well, my concern is
Whistle.
that we do have a challenge right now with staffing. And so that increases my concern when it comes to at least those 2.46 hours per day. And so, again, I needed to voice that because staffing has been an issue. And these are the folks that need the care the most. So in terms of 1 to 10, I can't give it a number. So thank you.
Thank you. Seeing no more questions, thank you. Thanks
Thank
for
you
being
very
here.
much.
Okay, committee. We do have this docket before us at this time. I would entertain a motion from members of the committee if somebody's ready to make a motion on this. Senator Wintrow.
Thank you, Madam Chair. I'm a little rusty. I haven't made a motion in a while, but I would, let me get the right number on this. I would move to accept docket 16-0302-2301. Is that what I say? Thank you. And may I speak to my motion?
Yes, you.
Oh, I got to
would
get a
like-
second first.
Okay, it's been moved by Senator Wintrow and seconded by Senator Lee. Senator Wintrow, would you like to speak to your motion?
Thank you, Madam Chair. I'm so sorry I'm rusty, y'all. That's my first motion out of the gate this session, so I'll do better next time. But I just want to thank everybody for testifying. I want to thank for the hard work. I think those concerns that were raised are noted, and there are people that will be vigilant watching that. But as you noted, there are staffing issues everywhere, and we as a state, we need to get our arms around that and really work hard on that too. So, but I just wanted to thank you for that, but that's why I made that motion.
Thank you. Any more comments? Seeing none, all those in favor of approval of docket number 16-0302-2301, say aye. Aye. Any opposed? Thank you. And we will send this on to the, okay, committee. I think next we're going to do a call with Mr. Steele on the first gubernatorial appointment at the top of your agenda. And we're going to have him on the phone.
I just can't, for some reason, the audio and video is not working.
Okay. Madam Chair, can you hear me?
Yes, can you state your name so we can see if our system's working good, please?
Yes, Madam Chair, my name's Clayton Steele. I currently work for Clearwater Paper.
Okay, Mr. Steele, please proceed. If you could tell us about a little bit about yourself and your interest in serving on the Board of Environmental Quality, please.
Okay. Well, I was born in Moscow, Idaho. I've lived in Moscow or Lewiston or the LC Valley my whole life. I didn't live in Idaho for about a year and a half when I lived in Clarkson right after I got married from college. But I started my career during college working for the Department of Environmental Quality. A lot of my experience is in air quality. I started as a field technician, worked my way up to an air quality analyst, and I was the air quality manager in the Lewiston regional office for a few years. And then I was the regional administrator. I may have been the youngest regional administrator in the state of Idaho history when I was appointed to that position. I worked as the regional administrator for about 3 years, and then I went out to Clearwater Paper where I was the environmental manager. And as the environmental manager, you know, you're kind of responsible for a lot of different environmental rules and permits and plans and things like that. But one of the big projects that I worked on was getting the air permit before we could get board approval for a $160 million pulping optimization project, where the mill replaced like 1950s technology for chip pulping with a large continuous digester and associated equipment. It was a really good project to work on internally, but externally I had to work with the state of Idaho to make sure we could get that permit in hand to get the funding for that project. The last 2.5 years or so, I'm in a little more senior role. I work out of our Spokane office. I'm responsible as the primary environmental person for Clearwater Paper for our company across the United States. One of the reasons that I think I would be a very, very good fit for the current role that I'm in with respect to air quality is I have a very strong background with how rulemaking happens, how policy decisions are made, how guidance is developed. And I feel that I would be able to kind of bring a kind of a unique view from having worked in the private sector and public sector for how things need to get done at DEQ.
Okay. Thank you. Committee questions for Mr. Steele at this time. Senator Wintrow.
Thank you, Madam Chair. And Mr. Steele, since you're on the phone, we better ask you at least one question. And you seem to have a really good resume. And I usually ask about skills and qualities that make you a good match for the position. But maybe you can talk about, with your skills and experience, what inspires you about being on this board?
Mr. Steele, please answer.
One of the things that, kind of like what I mentioned, that just from a big picture standpoint, that I feel like I'm going to be able to bring to the board, like I said, is my experience working in the private and public sector. But one of the things that personally that I've already shared with Darren with the governor's office is, it's kind of a new challenge. For me personally, I've done quite a few different things in my life, and this is kind of like another step. And I feel like I'm going to be able to give back to the folks in the state of Idaho. I want Idaho to be a good place to live. I want it to be a good place for people to be able to raise their family. And it's a kind of a unique challenge. There's already a contested case that apparently the board doesn't see contested cases very often, but there's already a contested case that the board hasn't seen in like the last 10 years. I look forward to, kind of wading through, understanding what the details are in that case and providing my input for how things should proceed.
Thank you. Mr. Steele, we will not vote on your appointment today. We'll take that up tomorrow at our meeting. But thank you for bearing with us and trying to get the system to work. And we appreciate you, your willingness to take a phone call to do this. So thank you very much.
Well, thank you, Madam Chair. Thank you, members of the committee. Thank you.
All right, committee, we will take that up tomorrow.
Thank you.
The next item on our agenda committee is docket 16-0314-2301, hospitals and adoption of a temporary rule. Mr. Elkins, could you come to the podium and identify yourself again for the record?
Madam Chair, members of the committee, thank you for the opportunity again to come to you with this rule, temporary rule. My name is Nate Elkins. Again, I'm the Bureau Chief for the Bureau of Facility Standards, Division of Licensing and Certification under the Idaho Department of Health and Welfare. I am presenting to you temporary rule docket number 16-0314-2301 regarding hospitals found on page 3 of your temporary rules review book.
Proceed.
Thank you, Madam Chair. Today, I ask you to extend this temporary rule. The rule is simple in nature. The extension of this temporary rule allows hospitals more flexibility for physician recredentialing intervals, thus resolving a conflict between language of the Code of Federal Regulations and that found in the Hospital Rule Chapter 16-03 or 16.03.14. This change was recommended and requested by the Idaho Hospital Association and other stakeholder groups when accrediting organizations such as the Joint Commission made similar revisions to their requirements for physician recredentialing. This rule change allows those accredited providers to benefit from these flexibilities now instead of waiting for the rewrite chapter in 2025. This rulemaking is not anticipated to have any fiscal impact whatsoever on any state general funds or any other known funds. Licensing and certification and the Idaho Hospital Association, which represents most of the hospital providers throughout the state, held multiple meetings throughout the month of July 2023. Public involvement was not held, but will be held during the zero-based rewrite this year for 2025. In conclusion, this temporary rule change standardizes state and federal requirements for physician recredentialing in hospitals. It allows hospital providers to benefit from recent changes made by the accrediting organizations such as Joint Commission, thus reducing administrative burden without impact to the health and safety of the public. I ask you to approve the extension of this temporary rule. Madam Chair, members of the committee, thank you. That concludes my presentation, and I stand for any questions.
Thank you. Do we have any questions of the committee? Okay. This docket's before us.
Is there any testimony?
Do we have anybody to testify?
Madam Chair.
Senator Lee.
For a motion?
Motion's in order.
I move that we approve docket number 16-0314-2301.
Been moved by Senator Lee, seconded by Senator Harris, that we approve this docket in front of us at this time. Is there any discussion? And would you like to speak to your motion at all? Senator Lee.
Thank you, Madam Chair. I'm just, oh, gosh, I got a parliamentary question.
Yes.
I would still, before we take a vote, would like to speak to my motion that I appreciate the temporary rule and I look forward to the permanent rule, but also I would like to declare Rule 39H that I currently serve on a community hospital board and would like that be noted in the record before the vote is taken.
Thank you. And Senator Harris.
Madam Chair, I would also like to declare 39H as I serve on a hospital board.
Thank you for those declarations. So noted. Okay, committee. We've had a motion and a second. All those in favor, say aye. Aye. Any opposed? Thank you. The motion passes. Okay, that's the end of what we've got today going. Tomorrow we will have a meeting and look forward to that agenda. We'll do probably another couple of our rules as we're making progress through these and do the rest of our gubernatorial appointment business. So with that, we are adjourned.